How much do you think my hospital should invest in electronic medical records over the next few years? This was the question asked of me last week by a CEO of a large healthcare system. He was a member of the American Hospital Association's Long-Range Policy Committee, and I had just shared with them a message that might be summarized in 5 words. Big changes ahead. Get ready. More specifically, I was predicting that healthcare in the United States would soon move from being hospital-centric to being home-centric, that health would become a customized strategic planning exercise with a 100-year forward horizon, that new technology would focus on engineering the home for health in the same vein as GE's Carousel of Progress cataloged GE's success in engineering the kitchen to improve the quality of our lives, that killer applications were on the way that would suck up your varied health data, organize and customize it, and assist you in your future decision-making. That this transforming killer application would flip the entire healthcare system toward active prevention versus passive data aggregation. And finally, that this organizing online scaffold, which I call the Lifespan Planning Record, would be free, online, ubiquitous on all computers within 5 years, and most importantly, come from the consumer side rather than the provider side. Now, for any of you who have followed me over the years, there's nothing new in the messages above. On June 27, 2005, I delivered the exact same opinion to Louis Burns, then Vice President of Intel Corporation and the General Manager of its digital health, in my conference room in New York City that day, and some months later I shared the same concerns in the same location with David Brailer, then charged with building out a virtual medical highway for President Bush, and again in the same place by conference phone with the leaders of DOSIA, a large employer consortium interested in health platforming. Face-to-face, over the next 3 years, this same vision was shared with varying degrees of penetrance with health information pioneers like Don Detmer and Paul Tang, consumer association giants like Bill Novelli of AARP, John Seffrins of the American Cancer Society, and the current president and executive director of the American Heart Association. Medical association leaders like Mike Maves of the AMA, John Russell of the American College of Surgeons, and Doug Henley of the American Academy of Family Physicians, and a range of top leaders from politics, nursing, long-term care, integrative holistic care, and the consumer health and preventive industries. And yet, it's taken this long, 4 years, to hear the right question, that is, the question above. What this hospital CEO was asking, as he clarified it in person last week, was, if ultimately healthcare is to be centered in the homes of hundreds of thousands of families we serve, and if we are providing a portion of the data to them so that together we might plan the future, how much should I be paying today for a proprietary system not designed to integrate with these new consumer platforms that will shortly arrive? Now, it's a complicated question. The short answer is you must invest enough. But what's enough? Enough to properly organize hospital data to maximize quality and safety as you address the combined chronic disease burden of your patient population. But, and here's the tricky part, enough also to prepare yourself to link easily to the coming open source consumer health platforms and ensure two-way, 24/7 communications with your patients and forward planning activities. As I flew back from Chicago last week, I wondered, as I have so many times before, whether my message and its purpose, that is to encourage health leaders to embrace technology and use it to reinforce relationship-based care, had made any difference at all. Who knows? But one thing is for certain, time marches on. I awoke the very next day to headlines, GE and Intel working on home health care. And to Intel's Louis Burns' words, quotes, "Today's systems just won't scale. Healthcare has to go efficiently into the home," close quotes. That's GE with $17 billion a year in everything from medical imaging to standard electronic medical records, and Intel with a virtual personal health record application called Health Guide, with two-way video capability that links the people to the people carrying the people. Look for GE to take the lead because they have an excellent presence in hospitals and homes, and they're well positioned to bridge the two. And they're excited about it. It's the carousel of progress all over again for them. Says Jeff Immelt, head of GE, quotes, "Improving healthcare accessibility and reducing costs are essential to economic recovery and growth. We think this partnership offers the potential to lower costs by keeping people out of hospitals while giving health professionals the data they need to deliver the best possible care. Intel and GE share a vision to use technology to bring effective healthcare into millions of homes. Together, we can deliver innovative products to serve this rapidly growing market," close quotes. Now, back in 2005, I said, the train will soon leave the station, and you don't want to try to catch it once it's gained a full head of steam. Well, it's left the station now. Best strategy for hospital CEOs today? Buy a ticket and climb aboard. For Health Commentary, I'm Mike Magee.